Let us pray. Almighty God, who in your infinite wisdom and providential goodness has appointed the offices of leaders and parliaments for the welfare of society and the just government of humanity, we beseech you to look upon with your abundant favor these your servants, whom you have been pleased to call to the performance of such important trusts in this land. Let your blessing descend upon them here assembled, and grant that they may, as in your presence, treat and consider all matters that shall come under their deliberation in so just and faithful a manner as to promote your honor and glory, and to advance the good of those whose interests you have committed to their charge. Amen.
Yeah, thank you, Clerk. Let's have accounting officer introduce your team.
Good morning, Chairman, and honorable members of Parliament and the Secretariat. I have the pleasure to introduce my team, but let me first introduce myself. I'm called Dr. Barije Celestine, the accounting officer for Mbarara Regional Referral Hospital, and at the same time the hospital director. Thank you very much. Over to you.
Thank you very much. Good morning, everybody. My name is Peter Okelo Odeke. I am the Principal Hospital Administrator.
Thank you.
Thank you. Good morning, everyone. My name is Gawa Bronze, Hospital Internal Auditor.
Good morning, ladies and gentlemen. I am Omita Kenneth Yafes, the Procurement Officer.
Morning, ladies and gentlemen. Ben Nahaba is my name. I'm the accountant.
Morning, ladies and gentlemen. I'm Paya Semojon, the Principal Human Resource Officer, Mbarara Regional Referral Hospital. Thank you.
Thank you. There's no lady working in the Mbarara Hospital. Yes.
Good morning.
Start from the other side, then come here.
Good morning. I'm Mbarara Rachel from the Legal Department.
Kana Moses, Legal Officer on the committee.
Susan Arite, representing Accountant General's Office.
Good morning. My name is Godfrey Bagore, Principal at Mbarara Branch.
Good morning, Chair and members. Raymond Oporoto Bluka, my name is Principal Auditor, also the General attached to this committee.
Thank you, Chair. Good morning. My name is Jean Kabibi, Technical Assistant attached to the committee.
Yes, good morning, honorable members and Neko from Mbarara. My name is Emau Mikaya, the Technical Assistant to Park.
Thank you, Honorable Chair. My name is Alex Onanyang, Assistant to the Deputy Chairperson. Thank you.
Thank you, Chair. I'm Detective Assistant Inspector of Police, Watch Michael, CID Officer attached to the committee.
Thank you, Honorable Chair. My name is Gilbert Ainumjisha, I'm clerk to the committee.
Good morning, everybody. I'm Nawat Rosemary, Member of Parliament, Amudati District.
Thank you. My name is Ken Pipi Ujara. I represent the people of Chua West, Kibum District, Deputy Chair of Park. But I'll be the one chairing this meeting. You're most welcome, Doctor, and your team. We have members of the fourth estate who will come and join us, and we hope also other members will come and join us. You know, we are in a very dire situation of election period. So to get members in the parliament now is very difficult. But hopefully the others will come and join. I do not want us to take a lot of time on this, but let's first hear from you, Doctor, on the issue of COVID-19 in Mbarara Regional Referral Hospital, and how you're handling the situation, the effect, the impact and how you're managing the situation on the ground there. Is it an alarming situation? Are we going to be able to do something as Uganda to address this issue of COVID-19? Or you are anticipating something that is going to be worse for the country? So you're most welcome.
Yeah, once again, thank you, Mr. Chairman, and members of the committee. Once again, I want to highlight on the issues of the talk of the day, or the town, or the talk of the nation, which is COVID-19. I will begin with the background. We joined the rest of the country in fighting COVID pandemic. That was on the March 16th, 2020, where the hospital sat and formed 4 groups. That is infection prevention and control. We also began screening every person who enters the hospital using the student volunteers from Mbarara University of Science and Technology and Bishop Stewart University. Then we also established a surveillance team to work closely with the call center. The surveillance means we also wanted to know what is happening in the community. And then, of course, as a hospital, we established a very effective case management, which was involved in improving existing isolation ward, but also set up COVID intensive care unit. And then we also identified supporting partners who were able to support us at the time. During that time, of course, we have the old isolation ward, and then we thought it wasn't good enough. The picture is not here, but on the same slide, on April 8th, we got someone who gave us 100 million, that is the MGH, and then we started the construction. I want to report to this committee that this construction has been roofed. We are waiting for complete finishing, and it will host 36 intensive care beds. So when you see slide 5, that picture was taken some time back. Of course, things have changed, and then we also received APSA tent from the Ministry of Health. As I said, this new isolation will be 36 bed capacity, 18 beds for suspect cases and 18 beds for confirmed cases. We also have staff area where they put on and put off, donning and doffing, and then we have a laundry space, and of course this is ongoing. Mr. Chairman, we established, because this one wasn't finished, we go to one of the areas where we established high dependency units, but also ICU. We shifted or borrowed 4 ventilators from our ICU. We put them in a different place, and 1 ventilator was donated by Chikagate Power, and then we made sure that in case anyone fails to breathe, we should be able to handle this as quickly. Now, on page 3, on human resource, I want to report to the committee that we have 48 of our own staff. Health workers have been engaged in the help of COVID-19. Not everybody is actually involved. Others are continuing with the regular work, but we have got 148. These include 18 specialists, 5 medical officers, then paramedical and psychosocial workers 11, critical care nurses 7, laboratory 4, enrolled nurses 12, administration 13, support staff 44, and student volunteers 34. So that is a very big formidable team which is managing COVID-19 in our hospital of 148. We did some staff training, 60 in intensive care units. That would include nurses, volunteers, including screeners, call center, and that. I want to report here that part of the thing that we had to do, especially in the lockdown and even up to today, we feed 142 people breakfast, lunch, and dinner. Initial feeding of all hospital staff during the lockdown That one were feeding over 300 people, but when they unlocked, we couldn't sustain. We introduced some bit of cost sharing, but now those who can get a free meal are the 143. Now, there was also the issue of transport. During the lockdown, there wasn't any public transport, as you know. We had, and I want to thank the Parliament, which had given us some money to buy a bus of 30 people. We also borrowed one from the university and a coaster bus. The three were able to do all routes of Mbarara and getting people from their homes to the hospital. That is in the morning and in the evening. That was done and until the lockdown was ended. Now, the staff outreach and the community, we were not only involved in our hospital alone, but we went outside because Mbarara Regional Referral Hospital covers 12 districts. Now we have the 13th, which is the city. 134 trained handling COVID-19 suspects established in isolation centers. 39 district case team members were trained, 95 health workers, including 28 nurses, 27 clinicians, 20 lab staff, 20 surveillance persons in the then 10 districts, and in 18 health facilities were trained. So we made sure that all those who were involved and got trained to be able to handle the disease. Now, the data collection, I just want to, this is of importance because on March 20th, April, we are using paper to collect data. Everyone who enters the hospital, we are recording temperature and recording the details where it comes from. 27 April, we introduced a software on the phone whereby we have been able to collect data from 28,736 people screened as of 31st July. Now, this one helps in case someone has a temperature, is ushered, and we don't have to put this person in the queue, and he may be suspected, so we have done that since then. Now, when we established the call center, we have two numbers which were popularized on our radio and TV, and these numbers were given out. People can call, especially people who are coming from outside the country. They are able to say someone has come, or someone is having some signs which have been reported. And I must report that one of the cases which came from Mbarara, Tasso village, those of you who know Mbarara, she brought herself that I have these symptoms, and when we tested, she was actually positive. And we combed the whole area and were able to manage her. She survived well. So on page 4, summary of the screening. That graph, you can see it has a dent in the middle, and that dent was that we used to screen people entering. Now, when we got the first COVID-19 suspect, people disappeared. As you can see, they sort of abandoned the hospital because they thought everyone was having corona. Others stayed. However, as we tried to manage, then the graph stabilized, and although we did not go back to the original shape, and this is also one of the impacts of the disease, whereby people get scared and they avoid coming to the hospital. In fact, information, education, and communication campaign. As a hospital, we have been able to customize and popularize our infection control material, including posters and banners, flyers, radio programs. We have had so many TV, mainly the local TV West, and weekly tweets and meetings. Clinical care. I want to report to you, Honorable Chair and members, that we admitted 35 suspects between March and 16th of May. 16th of May is a very important date for us. All those 35 were suspected; they were all negative. Now, on the 17th of May, number of samples sent to UVRI between March 16th and July 31st were 497. So May 16th, we admitted the first corona case. That was our first case. So far, cumulative admissions, confirmed cases to date are 38. Cumulative discharges are 29. Currently in the isolation, we have 9 patients. These are 7 Ugandans, one is a Kenyan, and one is a refugee from Rwanda. These are all males and they are stable. So, number of repatriated patients, I want also to, it's one of the impacts. Because of our border in Mirama Hill and one of Chikagati, but mainly Mirama Hill, all those Kenyans who test positive have been given to us to take to Mbarara. I want to report that over 40 drivers were repatriated to Mbarara, and we've done that successfully. The team doing that, we have tested them frequently, and they are negative, despite staying with these patients in the car for more than 7 to 8 hours. Now, discharged patients resettled to their homes are 7. Initially, we were taking these patients back to their homes with using another vehicle, including bringing them to Kampala, but over time it was overwhelming. So, and patients facilitated with public transport are 22. Later on, when they reopened and there was public transport, we give them money and then they go back to their homes. Some of the main challenges, most patients brought without personal supplies, and we've tried to buy some of these personal effects. Lack of funds for essential items like saturation machines. Sometimes also to this committee there is a delay, and sometimes it causes a lot of anxiety, and that wouldn't be good, because when a result delays, then you cannot actually effect what you want to do. There are 17. Well, you may have seen that in the papers, but that was the Committee of Health Members of Parliament who came to Mbarara Regional Referral Hospital. They toured most of our areas, and they gave that in the papers. But I also wanted to mention something about especially hand washing. When you come to the hospital, hand washing, now it has become a habit. Last night when I was leaving the hospital at around 1 o'clock, I saw people hand washing. There was no one forcing them, but they were entering, they were just hand washing there. Timekeeping. In the hospital now, our health workers keep time because of the use of the bus, but also because of the nature of the arrangement, people keep time. The hospital looks neater than it used to be. Duty coverage is now being covered mostly. Now, we have also been able to interact with the public, including interaction on the radio, phones. We were not visible anywhere on TV, but I think now, as health workers, we're also visible somewhere. We must report to this committee that generally there is availability of supplies, gloves and other things to use. These shortages are now less common than it used to be. The other thing is the feeding of the staff. Something we thought we wanted to do, but now we have done it, and we think we should continue to feed our staff. Either they pay a little bit of cost sharing, but at least people should eat from the place where they work from, not necessarily having to go around and waste time and sometimes cause a scarcity of workers in the hospital. Some negative things, care of the general public. Corona has really scared people, and some people have stayed at home. We've had a lot of some people really having to call the director whether it is safe to come to the hospital, but we are telling them it is safe. Well, washing hands, water bills, they may go up somehow, and also budget costs, that transportation and feeding. And I must report to this committee that the money which was given to us was for 3 months. It is now finished. We are left with little money, and I think if we don't act and give more money, especially for the next 3 months, some of these things we are doing may stop. And when they stop, we are in a precarious situation now. We may end up actually having more corona, and all the achievements that we made may be vanished. So I think as Parliament, we need to go through this and make sure that especially all the hospitals and districts which are managing quarantine, they actually need more resources. I want to thank you, and as an entity, we've really, Corona has taught us something different. We are not the usual people as before, but we are there to serve our nation as well. Thank you very much.
Thank you, Accounting Officer. I think members, you have had the brief. on the situation of coronavirus in Mbarara Regional Referral Hospital, which is very clear. And we have also seen the Parliamentary Committee on Health thanking the hospital for their readiness as a preparatory measure to address the issue of COVID-19. The report is very clear, so thank you, Doctor.
Thank you, sir.
Unless maybe we have another issue to ask on this. Otherwise, he was just giving us information on what the situation is. So if we need any clarification, I think we are free at this time to come in. If not, let me invite our guest, our witness. There is tea, there is coffee, there is water, there's some bites. Feel free to access it anytime. Okay? It's going to be working. Let's have a free atmosphere of eating and bites, and I think that will make us to move smoothly. And then for the gentlemen now, if you want to go to the washroom, go one step down, then on the left. One step down on the left, the third floor. Yeah. So you're most welcome. Is there any issue, members?
Yes.
Yes, Honorable Rosemary and Honorable Amura.
Mr. Chairman, I would like to find out from Doctor on page 2, under extra requirements, they have talked of the oxygen plant unable to refill cylinders. And when I look at this document, it's dated 8th May 2020. And if I got him well, it's like they were giving some funds, which he said is getting over. Now, I would like to find out from those funds, this oxygen plant, have you done something to repair it? Because we are told that with this COVID, it goes to the breathing system, and so when you have it, you'll need assisted breathing, meaning therefore that this oxygen plant must be functional. Have you done something to that oxygen plant? And then finally, you've talked of patients, resettling them, discharged patients, resettling them. Now, besides resettling them, do you make follow-ups to monitor them whether the COVID has not relapsed, something like that?
Is the accounting officer?
Yeah, thank you very much through the chair and the Honorable Rosemary from AMDAT. We have a functional oxygen plant. Mbarara Regional Referral Hospital has that plant connects directly to ICU, to theaters, to most of the new buildings. However, this plant, its capacity cannot go beyond pumping directly to those areas. So actually, when you go in other places, there's oxygen. We only needed extra oxygen cylinders to back up what we are using now. So the machine works, but when we put a filling station, it stops because the capacity is small. We brought this thing to our planning committee down there, and one of the recommendations was that we need an extra machine to back up what we have. So that's what we are planning to do. But the one there is working. So with the money which we got, and roofing offered free oxygen. So we always take a rollie to roofing, and every month we collect like 100 cylinders of oxygen. So we always have that oxygen using the COVID money that we got. So that's how we are handling. Certainly, we shall need our own plant, and I think the teams are working to make sure that it is given a full capacity. I must report this committee that this was the very, very first plant for the regional referral hospitals, and it was like a test plant. So the importation of our plant was a little bit smaller than the rest of the referral hospitals. That's why it is what it is. Now, The resettled patients are linked to the surveillance focal persons in different districts. If, for example, they were from Wakiso, we connect with Wakiso district health team and we tell them where they are. Now, in that district, there would be social workers, there would be what we call epidemiologists. They visit the family and make sure that these people have settled and they are not actually rejected by their own family. Some women who are running away from their husbands, but we go through counseling until that family is reunited, rather than someone running away from their husband simply because he has just recovered from corona. Thank you.
Thank you. Honorable Mura.
Thank you very much, Accounting Officer. I am happy to hear that the hospital is doing well, the hygiene has improved, and it becomes a desirable place for people to come and get treatment, and also your response towards COVID. I just want to find out from you, as a technical person, we have started gradually opening the country, but it seems what we call gradual opening is full blast opening. What do you anticipate with the commotion that is starting to grab, the congestion that is starting to grab, and the laxity of our people in taking SOPs seriously? And then two, you've also talked of improved supplies, the gloves and so on. I don't know whether that was in relation to supplies that you get from NMS. Are they now coming timely? Are the deliveries coming in time? You don't have any challenges? Also, thank you very much.
Yes, go ahead.
Yeah, thank you, Honorable. The opening actually is both positive and negative. But I will start on the negative aspect because I must report to this committee that just on Sunday, someone who is a money lender from Mutukula came and boarded a Global, and I think traveled to Kampala here, then traveled to Mbarara, slept in a hotel. Now after sleeping in a hotel, then I think he then slept with another friend. There was some friend there. Then the following day, this person wanted to go to his home in his district. But his friend advised him, since he's from Tanzania, to go and test for COVID-19. This person came and tested at our unit. On that very day, we had a suspect on our private wing, and we were taking samples to Mutukura ourselves to get the results on one day. So the following evening, this person turned positive. Now, we had to go to those hotels, see the contacts, see what. So what we are talking about opening, especially with this kind of public transport, is that people will sneak in and actually spread the disease. Now, what will happen is that unless we wear the masks as we are, if those people in Global are wearing masks, certainly they would not get the COVID. If they were cleaning their hands, they may be somewhere near a COVID person and they don't get the corona. Now, if the population cannot actually embrace the wearing of masks and cleaning of hands, then somehow corona will spill over to the community, and what you will see is the death. Because that's what you will see. Somehow people will be asymptomatic. When it reaches its target where it will go to kill people, then they will die. So I'm saying that I think all of us have the duty, not only health workers, to talk about and embrace the wearing of masks, the social distancing, and making sure that we don't actually put so many people together, because it may not have penetrated our society or our community, but when it comes, there are potential ways how it is going to impact on us. That is on the technical aspect. Now, improved supplies, why I said this, by end of June this year, this financial year which I'm reporting on, at least NMS with our 2 billion shillings which we have as NMS, they had given all supplies, and they were regularly bringing them, and as opposed to the previous time when sometimes you'd find money there and then you don't have the supplies. And generally they have tried to make sure that they bring supplies which are of infection prevention and control. yeah, there has been an improvement, certainly. I don't know, maybe also, because also when some partners also brought in, so we find that the supplies are there. Thank you, sir.
I think, yes, Honorable Rosemary.
Doctor, what about URI? Has it improved its time in releasing results? Because we've been hearing other entities complaining that there are delays by URI. I mean, Uganda Virus Research Institute.
Thank you, Chairman. Now, the testing actually, for us in this side of the western side, we use the Mutukula side. The Mutukula border. So there is testing, which is, I think, brings out results in about 2 to 3 hours. So actually, when you take results there, if you are able to drive there and come back, you will come back the same day. However, the people who come say from Bunagana and other border points, they have challenges of taking them there, then maybe another car bringing them like the next day. Then also, I think the Mbarara border, there is some delay because of the numbers, I'm told, and the results don't come out very, very quickly. So the issue of releasing results is very, very, very important, because when you delay, other things happen within that time that you delay. So the best thing would have been like results can come out the same day, or just if delayed the next day. If it takes 2-3 days, like now people are going Chadon, they need what? They need the results. So if they don't have the results, so many are lining up to test. So we are trying to make sure that these results can come as quickly as possible, because if someone delays, maybe he will lose his nomination. I don't know.
I think, Doctor, you know, what the honorable members are talking about is very important. The only challenge we have is that we don't know whether the government takes it seriously. Because when it comes to the issue of testing and release of results, we have seen many times that there's a little bit of a problem there. Some results are taking a month, 2 months. I don't know whether I was doing this now. I was not doing list.
I got mine yesterday.
I have not yet got mine. So you can imagine.
You're negative. If you're in the right side, they would have looked for you.
So yes. So I think it is a serious issue. We hope that we'll get the opportunity to offer this very important advice to the doctor, the medical, the minister, to understand what we are going in for. Because otherwise, I'm thinking, and as my colleagues have stated, looks as if we are losing it. We are going to lose it with this election period that is coming up. I don't think whether the issue of social distancing, washing of hands, with the excitement that people are going to enter into, will really do us justice in the fight against COVID-19. It might not. So these are issues anyway that we need to find a forum to address it, and then we'll see how to help. So thank you very much, Doctor, for your response. Now the chairman is requesting that you, as Mbarara Hospital Regional Faro, you furnish this committee with list of uniforms. Just put it down. List of uniforms supplied from 2015-2016 to date. How many uniforms have been supplied to your hospital? 2015-2016 from National Medical Stores. 2015-2016 to date. I know you didn't carry it. Have you carried that one? No. You will have to make sure you provide this committee with. Then 2, supply of drugs for 2017. Supply of all drugs from National Medical Stores from 2017-2018, 2018-2019, and finally 2019-2020. There is something that the committee is interested in terms of that information. So If you can provide this, today is Wednesday. Can you provide it? Is it possible to Friday?
Friday?
Yeah, because this is just you go and extract, then you send to the committee. So clerk, take note of that. We need to get this information as soon as possible. I think that's all for now on COVID-19. Let us now go back to our business. And as I said, I only wish we are not going to take a lot of time on this, because we have other demanding issues to do. Let's look at your final account. There are two issues that you need to clarify on your final account. Just go to final account. Your accountant is there. You should be able to help. This is a statement of financial performance based on classification of expenditure by nature. We have seen, especially on your NTR, non-tax revenue, you have collected 1.323611,682 billion. But you remitted only, you transferred only 221,540,000. And then there was an, so we want to find out that, what could have caused that issue. Because the policy is very clear that when you have collected your NTR, all the monies are supposed to be taken back to the treasury. But here you are seeing, out of the 1.3 billion you collected, you only transferred 221 million Uganda shillings. Similarly, in the other previous year, 2017-2018, you collected 1 billion, you transferred only 255. So it looks as if successful for the last two financial years, you have been transferring less money to the account, and we want to, the committee would like to understand that. Yes, accounting officer? Yeah. Just go to the point. Just be brief and then go to the point straight away.
Yeah.
So that we are able to proceed quickly.
Yeah, thank you very much, Mr. Chairman. And on the issue of NTR, our performance was that, first of all, we were expected to collect 1.4 billion, we collected 1.3. And we were not able to collect 76 million. Now, the reasons why we are not able to collect the 76 million was that at that time there was one of the machines that we used to collect money from is the CT scan, which broke down, and at that time we had to repair it. And the breakdown reports are all in the attached annexes. Thank you, sir.
No, I don't know whether you got my
yes,
my query. You referred to statement of financial performance. You have your accountants there? We are seeing here that you collected 1.3 billion as non-tax revenue, but you transferred to the treasury 221,540 million Uganda shillings. So meaning that you have been spending at source. You get what I'm saying? Similarly, in the previous financial year, you collected 1 billion and therefore you only transferred 255 to the treasury. It's a requirement by law that when you collect your NTR, you should first go to the treasury, then AIA is issued to you based on what you have collected.
Okay, I've got it. Yeah.
You got it?
Yeah, I got it.
Yeah.
Thank you, Honorable Chair. It's true that happened during these two previous years, whereby the remittances were so small as compared to what is collected. Now that we looked at, let's say now we are beginning a financial year. If we had spent, say, 1.4 billion, they should warrant a quarter of
Is your accountant there? I think you are not getting what is the explanation on that? Accountant?
I think, Chair, maybe let's rephrase this question for the accounting officer to pick it well. Let's start by asking, how much did you collect as NTR? And did you remit it to the consolidated account? Just as simple as that. How much did you collect? Did you remit it? If you didn't, what happened? Just as simple as that.
Sir, I corrected this year which we are talking about, I corrected 1.323 billion. All that was corrected. So the other money wasn't actually remitted. We paid people's salaries and other things that we buy drugs at source. That's what it is.
And that's where the chair's question now comes. You spent at source. Did you get permission to spend this money at source?
Good, yes.
Mr. Chairman, under that same table we are looking at statement of financial performance. We have a budget for employee costs. Now why is doctor telling us that they used part of the NTR to pay salaries? I need that clarification.
Okay, now non-tax revenue is the private wing. So there are people, over 20 people employed they receive money from what they collect. So they are not put on the payroll to use the money which comes from the central government. So what actually they collect is what we pay for them, and we pay for their NSSF, and also we remit money to URA. Now, it would be prudent, since if you take it to consolidated and they give it you back, to use it on the system to pay for this. But at that time, I think there was not a harmonized system of quickly reimbursing it so that we can actually pay these salaries and employee costs in time.
So, no, doctor, still we are not getting you, to be honest. The policy and the law is very clear that whenever you have collected money, government money, you are supposed to, I know you are putting it in your commercial account, commercial bank account, but that money is supposed to be transferred to the consolidated fund. Then appropriation in aid will be in terms of how you have been able to collect. And if it's over and above the warrants, you can still request them to supplementary to make sure you transfer.
I'll do that, sir.
But in this case, you know, you collected money, 1.3 billion, you only transfer. We want you to break down and submit this committee how you have utilized. Can you calculate for me the balance? What is the balance? What is the 221? No? Can somebody do for me? What is the amount there? 221 minus 1.3, which is almost $1 billion shillings. Can you get for us the schedule? Because that is already, you have become parliament, you have become the speaker, you have become everything, you did your own appropriation, you did your own spending. So we don't know whether this expenditure of 1 billion something was approved by the board. You have a board?
Yes, I have a board, sir.
So did they approve the expenditure?
Yes, they are approved.
They are approved. Do you have the letter for approval?
Chair, before we get the board to become parliament to appropriate, we should get clearance from Secretary PSST to confirm that we are given permission for the board to appropriate for you to spend at source. And Chair, it is not only 1 billion as you are talking. We have, in the previous year, there was a collection of 1,039,971, and even in that year
there was transfer of 255. So what would have expected in these accounts is the balance carried forward as opening balance for the year 2019. So we should get that balance added on the deficit now here and request for your receipt of transfer to the Treasury or clearance from the Secretary PSSD for you to spend the money source.
Now, my brother, can we get this clearance by Friday?
Yes, I'll get
the list of the expenditures, the 1 point something billion, as the one of the previous year. Then receipt of balance transferred into the consolidated fund.
I'll do that, Chair.
Because this one here, the auditor general, when you were there, what happened? Did you said you saw the letter? You didn't comment about what? Because now we are looking at the final accounts.
Yes, sir. Chair, what I remember, because I was involved in this audit, what I remember is that money was transferred to the consolidated fund, but like you are asking, maybe we need to make a reconciliation so that we actually clarify how much was collected and how much was transferred. But when we were reconciling, we had found out that most of the money had gone, and this money which is being shown in the statement is the money that had been transferred and expected back.
Yes.
Yes. The one that is appearing as 220 something. But all the other money had been properly approved and also transferred. But
can we get the letter, that approval letter?
Yeah.
Please.
They can provide it.
So that we are able to...
Let's also get
by Friday.
Confirmation of transfer.
Confirmation of receipt of transfer by Friday. Take note of that, Doctor. The other issue in the final accounts, 2.9 billion domestic areas accumulated over time. You have committed government to the tune of 2.9 billion 201,000. The financial year 2018-2019, and in fact, if you look at even 2018-2019, 2017-2018, there was also a massive issue of domestic area. Go to the financial statement of financial position. So can you comment about that, Doctor? Your accountant can help you because I know some of these things are technical for you. Why have you decided to commit government?
Thank you, Chair. The issue of domestic areas, I think most of it comes from, when we look at this statement, it is issues brought forward simply because over time we have been submitting the domestic areas for verification, and actually they have been audited and verified, but in the subsequent years this money is not forthcoming to clear off the domestic area, so it is sort of retarded. But as is required, we always submit. They are audited by the auditors selected by Ministry of Finance, and they are always verified and the schedules are available.
My brother, you see, there is a penalty for you committing government or spending on behalf of the government, and you need to appraise yourself with it. Doctor, have you had this over-accumulation of domestic areas? I don't know what section of the law, but what is the section of the law, okay, on the issue of committing the government? You are not supposed to commit government.
Section 15.
15?
15, yes.
Section 15.
Subsection 3.
Subsection 3. Can you read for us, Honorable Council?
Yes, it reads here that an accounting officer shall commit the budget of a vote based on the annual cash flow plan issued under this section. Yes, that's subsection 315. Maybe we start from 1. That after approval of the annual budget by Parliament, the Secretary of the Treasury shall issue the annual cash flow plan of the government based on the procurement plans, work plans, and recruitment plans approved by Parliament.
Yeah, so you can see that when you overcommit government or you commit government into unnecessary expenditure, you are actually breaking this law. And when you become a culprit, you go to section 79, which is very, very clear on how you should be handled. And by the way, even in 79, when you look at M, can you go to 79 and read M?
Chair, offenses under section 79. A person commits an offense if that person, without lawful authority under this act or any other act, incurs unauthorized expenditure or make unauthorized commitment.
You see?
And then the punishment is under subsection 2. That the person who commits an offense under this section shall, on conviction, be liable to a fine not exceeding 500 currency points or a term of imprisonment not exceeding 4 years or both.
So you see, when you are trying to do your work, you need to appraise yourself with this document. Because otherwise, the big hammer, the law, is going to catch up with you. It's very clear on the issues of commitment. Because when you commit government and you authorize you authorize unauthorized expenditure, because you can authorize an unauthorized expenditure. Because authorized expenditure is based on the plan, the work plan, and the annual cash flow issued and signed and agreed upon Parliament, Secretary of Treasury, and then you yourself. So if you go beyond that, it means you are really abrogating this very important book, this important document, the law. So you take note of that, Doctor.
Thank you.
And for that matter, we want you to break down. We want you to break down this. The 2.9 billion in domestic areas. Can you give the schedule to this committee? We want to understand how you decided from nowhere to overcommit government on this.
Yes, I'll bring the schedule
on Friday.
On Friday, and part of it actually is here because about 800 million was domestic areas, which we
Is it the payables?
Yes, it's in the payables. We actually got it and paid, and then part of this money is utilities, water, and electricity. So we are trying actually to avoid other creditors because those ones we don't commit ourselves whatsoever. But for water and electricity, and also since we have the human resource office and other offices, to make sure that whoever retires is paid in that very year to avoid any domestic areas of pension and gratuity.
Honorable members, yes, Honorable Mura.
Yes, thank you very much, Chair. Chair, I want to refer you to page 24.
Page 24?
Yes, statement of appropriation. Accounting officer, are you there? Are we the accounting officer?
Yes, I'm there, sir.
Yes, what was your budget for goods and services? And what did you receive? That's one. Then two, what was your budget for social benefits?
Which is blank.
Yes, Chair. For goods and services, the budget was 1.750. The warrants were 1.234. The actual was 3.266. Confirm that? Yes. Where did you get the difference, the top up, and if so, which other services were affected? Was it a supplementary?
Imagine there, the value is 1.5. Yes.
And then, Chair, for social services.
Just take note of what is very important, what is trying to raise.
For social services, you didn't budget for anything, you did not receive anything, but in your cash flow statement, you have 3.75 to 15. And when you look at page 43, the statement of outstanding commitments, whether you had outstanding commitments in line with that, it is still 00.
Yes, accounting officer, can you respond to the issues raised by the honorable member?
Let the accountant.
Okay. Yes, take note.
Let them also take note of this one. Still on page 43, there is employee salary arrears. Then, under note 24, payables, we have salary arrears of 98 million. Now, I would like them to explain why under note 24, under salary arrears, they have 98,374. But when it comes to these outstanding commitments, employee salary arrears, it is 0. Can you throw more light on that?
So, I want to begin with let me begin with this, the question on statement of appropriation, where you inquired why the budget is 1.7, warrants 1.2 billion, and the actual is 3.2. Chair and honorable members, this again goes back to what we had talked about, the issue of domestic areas. Although the budget was 1.7 and the warrant was 1.2, we incurred additional costs that were not paid for as domestic areas, so that's why the figure goes to 3.2. Then on the issue of social benefits, where the honorable member asked why the budget is zero. Social benefits under the chart of accounts are classified as benefits to employees. But when you look at the item for